Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and today I am joined by Megan with Coastal Orthopedics. Good morning, Megan.
Good morning, Brittany.
How are you today?
I'm doing great. How are you?
I'm doing awesome. So it looks like you're in your office there at Coastal.
Yep. Here in the library at Point West at our location that's near Blake Hospital.
Very nice. And before we kind of jump into Coastal, I want people to, of course, get to know you a little bit better. Most of the industry professionals know you, they love you. So I'm excited to have you today. But for those that may not know you as well, can you share some of your background and experience in the industry?
Yeah, absolutely. I moved here in 2004 from Maine and got a job right away in home health. I was a home health marketer for about 10 years. I spent 5 years with senior home care down in the Venice market, then worked with Nurse on Call for a number of years, and then I did Greystone Home Health. And then after that, I spent a little bit of time at Brookdale, working in assisted living. But most recently, I was at Hawthorne Village. So I was the marketing director there and also the hospital liaison. So I worked with the hospitals to get patients discharged to skilled nursing. But I worked with a lot of the orthopedic surgeons that are with my current group, Coastal Orthopedics. So moving into this position, it's a bit of a change for me, but it's really exciting. There's a lot of really great things happening with Coastal and a really great group of surgeons. So I did start right smack in the middle of the pandemic. So that was an interesting experience to start with a company who's basically, our business had been shut down for about 6 weeks because, the bulk of what we do is elective surgeries. So I got to start right in the middle of that time and really kind of see what Coastal Orthopedics is all about. But now we're kind of ramping back up and back almost to normal, as normal as things can be. But I'm really excited to be here.
Awesome. Well, and you know what? You're one of my favorite people, and I'm not supposed to admit that because you're not supposed to play favorites, but you really are. You bring such a professional and just an amazing, I guess, demeanor and experience to whatever you're doing. And so Coastal is very lucky to have you.
Oh, thank you.
Absolutely. Well, let's talk about Coastal. And most people, of course, know the name Coastal Orthopedics, but how many different locations do you guys have? And we'll get into as well the outpatient surgeries and kind of some of the procedures and preliminary things you're doing amidst, the times of today.
Yeah, absolutely. Coastal Orthopedics, we have 19 providers here. And then we have 3 clinics. So one clinic at Point West, which is where I'm located up by Blake, one clinic off of State Road 64, and then the other one in Lakewood Ranch. Each location also has physical therapy on site, MRI. And we also have 2 outpatient surgery centers, one in Lakewood Ranch and another one here at Point West.
And what are some of the changes that you guys have made? Because everybody has kind of pivoted, with everything that's changed. What are some of those things that you're doing now in place for safety for patients?
Yeah, it's really interesting working in healthcare right now because I think there were, things that have kind of been on the horizon that with COVID coming in, has really forced companies to become really innovative and make changes really quickly. So we've done a handful of things. One of the things that we've started is an online paperwork system. So instead of a patient coming for an appointment at our facility and filling out the paperwork in our waiting room, we're sending them the paperwork a couple of days ahead of time so they can fill it out 100% online and then get it back to us. We're really trying to cut down on the amount of time patients spend in our waiting room. So we're trying to find ways to be more efficient, both for the patient and for ourselves. So if we can get that paperwork ahead of time, we've had to implement a whole new system, but it seems to be working pretty well. And then we've also had alternative waiting for patients. So if they come in, if they want to check in for their appointment, they can go wait in their car, and then we'll text them when they're ready for their appointment. We've also implemented some telehealth, like a lot of providers. So with orthopedics, it's a little different to be doing telehealth because there's a lot of manipulation and patients need to move, and our physicians have to sometimes put their hands on them and see how their joints are working and see where their pain is. So the telehealth appointments we've been doing are mostly like the first post-op appointment, but sometimes there would be some other instances where that would be appropriate. So we are doing telehealth as much as we can. And then, of course, we have our outpatient surgery center. So patients that that need to have a surgery, that don't want to put it off any longer, can avoid the hospital if it's appropriate for them. Their surgeon would be the one to make the decision about that. But we're also doing COVID testing for patients before they have their surgeries. So we're doing it right here on site, kind of as a drive-through for patients that have surgery scheduled for next week. They'd be coming in this week and getting a test just to make sure everybody coming through our doors is free of infection.
Well, it sounds amazing. It sounds like you guys are really taking care of your patients. And I did want to share a couple things on my screen as well. And I will do that real quick here. So your guys' website, of course, coastalorthopedics.com. And as you were just talking about, I thought it was relevant to bring up just the updates that you guys are providing here on your website are great. And of course, you can kind of browse through the physicians and the services and everything like that. But also, you had sent this over to me and I thought it was great. This is just one of the things that you had sent over to me, but just talks about some of the things you specialize in. So I don't know if you wanted to touch on any of these things specifically.
Yeah, absolutely. So, we are a full service orthopedic group. So we have upper extremity, shoulders, elbows, hand, wrist. We have lower extremity, foot and ankle, spine surgery. So we have 2 spine specialists. We have total joint replacement, sports medicine, and interventional pain management. So I did want to touch on the interventional pain management real quick, because I think when a lot of people think of pain management, they think of medication management and prescribing opioid medications. And that's not what we do. What our pain management specialists do is really look at alternative ways of coping with pain, with chronic pain. So we're talking about steroid injections or nerve blocks or spinal cord stimulators, those sorts of things. So for the patients that are either not a surgical candidate or aren't quite ready yet, this is really a great alternative to having surgery. So the nice thing about Coastal is if somebody thinks they have an issue, they've got pain, if they come and see one of our surgical specialists and they determine that maybe they're not quite ready for it yet, they can be referred to one of our interventional pain management, and they can try a couple different things along with physical therapy to see if that can alleviate their pain before we go the surgery route.
Absolutely. And I'm going to switch back over to you here. So with all the services you guys do provide, and of course, elective and non-elective surgeries, what is the first step for somebody to take? Do they just reach directly out to the office to discuss, a treatment plan, or what's right now the best way to get that information if somebody is interested in, having Coastal Orthopedics take care of them?
Yeah, absolutely. The best thing to do is, if you see your primary care provider, make sure that the primary care, makes a recommendation for an orthopedic follow-up. But, if you don't have a primary care provider, you can certainly call us directly. And we have a call center. So when you call in and try to make an appointment and kind of describe what's going on, our call center can help point you to the right provider. So if some people think that they have back pain, but it turns out it's more shoulder and neck pain. So based on the way that you're describing it, my call center will be able to set patients up with the right type of provider. And between all the different providers and the different locations, we can usually accommodate people pretty quickly.
Awesome. And the call center, do you have that number handy? I'm really testing you now to see if you have it. If not, I think I have it on your website here. So let me jump over here. Megan, is this correct? 941-792-1404?
Yep, that's the main number. And you can follow the prompts if you're a new patient to make an appointment, and you'll get right through to the call center.
Perfect. And I'll share my screen one more time here for your website. So again, if people are watching, here's the phone number here at the top website, which is 941-792-1404. I will make sure in the post to put the phone number, your website, all the good stuff that you guys are doing. Megan, do you have any last words to share with us?
Well, we just really want to make sure that people know that Coastal is open. We're safe. We're taking a lot of safety measures. Everybody's required to wear a mask in our facility. And, we don't want people to think that their pain needs to wait, because there are things that we can be doing right now to treat you safely, to make sure that you're comfortable, especially when people are at home and kind of outside of their normal routine. Just don't put care off if you feel like you're in pain.
Definitely. And I am excited because we're going to be doing a lot more videos with your physicians there. So I want to make sure that people know that those are going to be coming up. We'll be scheduling different physicians and having different educational talks on what their specialty is. So definitely look out for those videos here in the near future. So Megan, thank you so much for joining us. I appreciate your time. I know it's precious, and I hope you have a fantastic rest of your day. And again, thank you so much.
Thank you.